Hi there, I'm Jacques Fauteux. I'm the Assistant Chief Statistician for Strategic Engagement of Statistics Canada. I'm a member of the CRDCN Board of Directors, and I have the privilege to be your moderator for this webinar. Pour ceux et celles qui se demandent qui je suis, donc je suis Jacques Fauteux. Je suis un gars non seulement du Québec, mais qui habitait partout au Canada. Donc aujourd'hui, je suis la personne qui est votre hôte et dans mon autre carrière, autre que hôte, je suis le chef adjoint d'engagement stratégique à Statistique Canada. I think we're about 150 people from universities across the country and from different levels of governments, and probably some other folks from nonprofits and interested parties that are here to talk a bit more about one of the third CRDCN webinar that we've been holding. I hope this event will inspire you to continue to inform the crucial analysis and action taking place in communities across the country. This series is about connecting colleagues and ideas from the common good, for the common good. It's also about leveraging our collective ingenuity, about bridging gaps and overcoming limitations together by focusing on the art of the possible. Vous êtes plus de 150 participants à répondre à cet appel, du moins on l'espère. Une initiative importante de mettre en contact les chercheurs avec les spécialistes des données et des politiques publiques pour qu'ensemble nous puissions répondre aux enjeux essentiels. Nous espérons que cet événement vous incitera à continuer à porter main forte aux efforts d'analyse et d'engagement reliés à la COVID-19. Bien que ce webinaire se déroule en anglais, un résumé bilingue sera disponible dans les semaines à venir. Vous êtes aussi invité à poser vos questions dans la langue officielle de votre choix dans la boîte de questions. I'm delighted to welcome some of our speakers. Well, actually, all the speakers are here now. So Catherine Eck, Marc Frenette, Cindy Perry, and Alexandra Blair, who each have valuable insights to share from their respective vantage points. CRDCN is celebrating its 20th anniversary this year, and I'd like to thank CFI, CIHR, SHRC, StatScan, and university partners from across the country, as well as provincial governments and private sector partners for their ongoing supports. Nos panélistes will all speak for 5 minutes about how COVID-19 informs the research questions to be asked, the data that can be brought to bear to address them, and the mechanism to come together across geography, disciplines, and sectors to inform Canada's efforts. After that, we will respond to questions submitted at the time of the registration or today from the Q&A box, and Byron will help us with that. Regardless of whether your question gets asked, they will provide valuable insights to inform CRDCN's and our panelists' efforts going forward. Catherine, est-ce que tu es prête à commencer?
Oui, yes.
Okay, donc ma collègue Catherine, here's the question. So I think you want to discuss about the impact of school closures on the socioeconomic landscapes and how the new reality has brought a need for additional data. So how about you give us your 5 minutes?
Yes, so yes, thank you to have me here. I'm really pleased to be here. So I'm a professor of economics at the University of Quebec in Montreal, and I specialize in economics of education. So it's really a good panel for me today. So there's really 3 points I will be discussing, and one is about a tool we've been developing in collaboration with the Vancouver School of Economics. The other one is a portrait that we've done on inequalities in education across the country, and finally the need of data about children and youth. So if I talk first about what we've done, the risk tool, we call it. This is a tool that looks at the risk of contamination given the employment of the individuals, and eventually we want to look at how school closure have impacted the labor force participation of parents in different occupations, and this was all done thanks to the collaboration of StatScan. So this is a special project for which we've had access to the computer and access to the microdata, the labor force survey, the census data, and this was done in collaboration with the Ministry of Finance here in Quebec, and also our National Institute of Health, which would be the equivalent of like the CDC, I guess, in some other provinces, and also in collaboration with the Vancouver School of Economics. I'm not going to go into the detail of the tool, but if you look into the chat box here, you have a link to the tool for Quebec. And in 2 days from now, David Green on May 28th will present the tool in more detail. Since it has a health focus, it will be more appropriate in the webinar related to health. But using this data, we'll be able to look at also the impact that school closure has had, the impact it may have had also on education and in the post-secondary level. So this is one project we have going on. And then the other project we have was looking at inequalities across the country using PISA data. We started this project about a year ago, but really ramped up in the last few months because of the crisis. We thought it was really important to provide a really clear picture of what's going on across the country. So we're using data between 2000 and 2018. And what we see is that we have very large inequality across the country in every single province. It's not a problem that's specific to one province and not the other. So there are large differences in the ability children of they're 15 years old in that survey have developed by the time they reach 15 years old in reading, mathematics, and also in science. So the gap can be as high as 200 points, and this in the world of PISA represents over 4 years of education. So these are a large gap between the children who have more facility versus the children who are struggling. And then if we look at the gaps by socioeconomic status of the parents, the gaps between children whose parents are at the top of the distribution, so the top quintile, versus those that are at the bottom of the distribution, the bottom quintile, we see that the gap is around 120 points in Canada and also apparent in all provinces. And this represents about 3 years of equivalent schooling in the PISA world. So these differences are large, and what we conjecture in that paper is that the crisis we're facing, and with the school closure across the country for several weeks, now months, this gap will increase. And we need to take action to make sure that we support children and youth much better than we have done so far when comes the fall. So I invite you to read our study. It's again in the chat box, you will get the link to our study. And I think we really need to be more proactive in terms of what we do for children and youth. And then this leads me to my third point. It's about data. So I think in Canada, we've used to have a really good data set on children and youth, which was the National Longitudinal Survey of Children and Youth. But this was discontinued in 2008, and nothing has ever replaced it. I've been advocating for it for several years now, but I think in the face of the pandemic, it becomes even more striking how very little we know about what's going on. And I've tried several different ways to push our provincial government to collect data, but in a time of crisis, people are overwhelmed. It's not that easy to get people to work together to collect data, to know what's going on, how's the quality of teaching, how are parents able to cope with the demand of the school. So this is something we need to do, and I think it's something that actually we need to do at the country level to get a clear picture overall what's going on, to know when we will observe differences in PISA 2021, we will have data to inform us about what different provinces have done and how successful they were in their approach. So I'm right at 5 minutes, so I'm going to stop here and let my colleague pursue. Thanks.
OK. Merci beaucoup, Catherine. Marc, j'anticipe que tu es la prochaine personne. So Marc Frenette is our assistant, is one of my colleagues at StatsCan. He's our assistant director and research manager of the Social Analysis and Modeling Division. He'll provide insights on how the pandemic has affected education and how data can be leveraged to measure this information. So he'll build on what Catherine just said.
Okay, merci Jacques. Okay, so good afternoon, everyone. As we know, COVID-19 has had far-reaching impacts in all aspects of society like we've never seen before. And Statistics Canada has responded to this in a very timely way, I would say in 2 different ways. First of all, on the analytical side, the chief statistician, one of the first things he did was he initiated this new COVID research paper series, which are basically short articles that are released in a timely fashion. We're trying to get as many out as possible to address issues as they emerge. Secondly, on the data production side, we're creating new data sets to fill data gaps again in a timely fashion. They're malleable data sets and they're designed to address the issues as they emerge. So I'm going to describe what StatCan has done more specifically to address education and social issues. But I do want to say one caveat. I'm from the analytical side. I do have two colleagues on the line who are better equipped to answer questions specifically on the data side. I might be able to answer some of them, but hopefully those two colleagues have joined in. They're Pamela Best and Steve Trites, colleagues at StatCan. Okay, so I want to talk about three emerging issues with COVID-19. So first of all, there's this major shift towards online learning. We've seen this at the elementary, secondary, and post-secondary level. So we asked two questions on this on the analytical side. First of all, are school children prepared to learn online? This touches a little bit on what Catherine was talking about. So we used the Canadian Internet Use Survey from 2018, and this was actually the very first COVID research paper that came out back in April. So what we found was that the vast majority of school children did have access to home internet. However, those from low-income households tended to face more competition for scarcer devices with their siblings and their parents, who are, for the most part, at home as well. And also, low-income children were 3 times more likely to rely entirely on mobile devices to access educational resources from the schools. And that's very important because mobile devices, while they're good at receiving information, so taking part in education in a passive way, they're not so good at taking part in education in an active way. So in terms of producing educational information, it's not as good. That's the conclusion in the literature. So there are some inequities in terms of ability to participate educationally among school children. At the post-secondary level, we looked so far at international students. This is an important group. They've been rising in importance as a source of revenue for post-secondary institutions over the last decade or so in particular. But it's not clear what's going to happen to them in terms of their enrollment numbers in the fall. We might be seeing a big shift towards online learning. And it's not clear that for many of them that it might be, might not be worth it for them to enroll and pay much higher tuition fees or even displace themselves to come to Canada and risk having those programs turned entirely to online. Plus there's health measures at the airports and so forth. You have to go through quarantining. So we looked at the reliance of institutions on international students prior to COVID by field of study. Briefly, the results, these are not released yet, but the data are released, so I can talk about the preliminary results at this point. Math and computer science ranks the highest, with 1/3 of students being international, followed by engineering and business. The health fields are at the opposite.
We appear to have lost Mark.
So it looks like we've lost Mark. Oh, Mark, we've lost you briefly.
Oh.
So might I ask, you were talking about international students and basically you started coming in and out. So might want to repeat that part and then proceed.
Okay, can you hear me now?
Absolutely. Everybody's giving you a thumbs up.
Okay, great. Okay, so did I mention the part about the residents, the specialist residents?
Nope. So start with international students.
Yeah.
Yeah.
Yeah, okay, I'll just say one interesting fact about international students, just in the interest of saving time. We found that medical residents had a high, those programs had a high reliance on international students. 1 in 5 specialist residents were international students, and 1 in 9 general residents were international students. And we also found that China and India were top source countries at both the university and college level among most programs. So a second point I want to talk about has to do with some concerns about completing education and job prospects among students. And this was from the post-secondary education crowdsourcing data that was in the field in April and early May. So 8 to 17% of post-secondary students claim that they would not be able to complete their credential as planned as a result of COVID. So there's a lot of concern there. And beyond that, 2/3 of students, 67%, are concerned about having no future job prospects whatsoever. So on the analytical side, we took that last point a little bit further, the concerns about the future job prospects. And what I'm not going to go through all the details here. We have a paper that's complete now. It's going through production and should be released in the near future. But just to give you a little flavor of it, we simulated the earnings losses due to the economic downturn brought upon by COVID, which is fairly substantial. We know that the youth unemployment rates rose from 10.3% in February to a historic high of 27.2% in April. And what we found specifically, I'll give you the main highlight here, is that the economy does not now, and the remainder of the year, what we might see based on models is that this year's class of high school and post-secondary graduates could lose approximately $25,000 over the next 5 years as a result of the downturn. We're not modeling anything else but the downturn, the impact of the downturn itself, but still we're talking about $5,000 a year, so $25K over the next 5 years. And then my final point has to do with some social concerns that have arisen as a result of COVID. These aren't new concerns. These are things that have always been around, but I think they've taken on a new life because of COVID. So things like social isolation among seniors. It was always there, but now it's just impacting a lot more seniors in a more profound way. Food insecurity previously was more, affected low-income families more so. Now I think everybody to some extent has wondered about whether or not they could get their food in a safe way. I certainly wondered about it in the initial weeks. I had to reorganize how I would actually get my food. Mental health issues, that's another obvious one. So to address this, we've had to create new data, new timely data, such as the Canadian Perspective Survey Series, which is a web panel survey, as well as crowdsourcing data. So these are our new data forms for Statistics Canada, but I think they're timely and they're malleable. I think that's the key point here. They're basically designed to be restructured on a monthly basis or so as they come along and as issues emerge. So they're very flexible in that way. So that's all I'd like to say for now, and I'm looking forward to your questions. Thank you.
Merci, Marc. Just in the interest of time, but I'm going to ask you, Marc, if you try to maybe move your camera, people won't see you sideways, and I think it might help.
Okay.
I'd like. So just a little. Absolument. Thank you very much.
I'm actually on an iPhone, so it doesn't hold properly like this.
Okay. So Cindy, I guess now you're on deck. So Cindy is the Director of Policy Research and Analysis at the Ontario Ministry of Children, Community and Social Services. So she'll share how social services are adapting to vulnerable populations during this time and how they're preparing for the next phase of the pandemic.
That's great. Thank you very much. So I thought I would just talk about a couple of projects that my team is working on right now to give you a sense of what we're trying to gather in terms of data. And then I'll talk about some areas for questions that where we are hoping that the research community will be able to either fill in the evidence gaps or partner with us to figure these out. So there's two projects that I'll highlight in terms of what we're working on right now. The first is that we are working really hard to pull together a picture of the impact of COVID on vulnerable populations using real-time data. So this is from a wide variety of data sources and tracking systems, operational data, administrative data, data from external partners, and data from other ministries as well within the government of Ontario. And we are doing things like monitoring infections, recoveries, and deaths in congregate care settings. This has been a focus, of course, because of the higher levels of infection. So looking at developmental services, group homes, shelter settings, correctional facilities, other congregate sites. We are tracking impacts on some of these vulnerable populations via their use of our programs. So we're looking at how social assistance caseloads are changing over time, applications for emergency financial assistance, urgent requests for developmental services supports, intakes for child welfare, demand for shelters, things of this nature. And then we're also looking to continue, we're kind of continually week by week expanding the groups that we're trying to look at using, again, different and varied data sets to do so. One of those groups will be people with disabilities, looking at folks who are receiving social assistance currently, immigrant populations, racialized groups, and Indigenous populations. So that's sort of an overall kind of reporting and data gathering exercise that's underway to inform a lot of decision making that's going on in the province. The second area is sort of a more scenario-based planning for using economic forecasts, including data about which industries and workers are likely to suffer the greatest job loss and where we can anticipate a need for retraining as we support the emerging economy. So looking at things like where we're expecting the next, the growth in our social assistance caseload to come from. So a lot of that is pulling from private sector and research organizations, and their economic information has been really helpful in that work. In terms of looking forward to the recovery, there's a number of areas where we really feel like we want to lean on the research community to help us fill some evidence gaps. The first area that I'll highlight is risk prevention and mitigation strategies. So really helping us understand what helps to prevent the spread, as well as whether the effectiveness of a strategy to prevent spread differs by the setting or the population segment. So what, this could incorporate things like behavioral components, as well as the vulnerability of the group to having complications from COVID. The second group is the intermediate and long-term impacts. So looking at what are the impacts that we're seeing on these vulnerable populations over time, looking 1 year out, 2 year outs, or much further. From the education space, which children are most likely to fall behind because of the lack of in-school schooling, kind of related to some of the earlier panelists' comments and their research. And really just looking at what the implications are for long-term trajectories, including graduation rates and labor market prospects. We would love to look at the intersection of multiple vulnerabilities and how those are playing out over the long term, and also looking at intergenerational patterns. So we know, for example, that there are patterns of receipt of social assistance across generations. Do we expect that those patterns are going to continue in the same way, or would this disrupt that? And in what way would we, are we observing that that's happening? The third area would be kind of evaluating our approach, our being government at all levels, figuring out what has worked well about the emergency response to COVID in terms of protecting the most vulnerable, what could have been improved, what policies were really best able to mitigate impacts for these vulnerable groups. And then the fourth category would be preparing for the next crisis. So, what have we learned about what the longer term health and safety practices should be that we should be implementing, for example, in our congregate care facilities, and what has the pandemic taught us about improvements to make our existing programs more equitable? So I'll just stop there, and we can move on to the next panelist, and I look forward to chatting some more in the Q&A.
Thank you very much. So, Alexandra, you're the last person that's between us and questions. So how about introduce Alexandra, and then we'll carry on with her 5 minutes, and then we'll do the Q&A. So coming from the Lana School of Public Health at University of Toronto, She'll share her experience leveraging data to investigate the social patterns and identify social determinants to identify prevention gaps and better inform policies. I think she's also working with some of our StatScan stuff too. So without further ado.
Thank you so much. So hi, everyone. My name is Alexandra Blair. I'm a postdoctoral fellow of epidemiology at the Dalhousie School of Public Health. I work with Dr. Arjman Siddiqui and Abtin Parnia from the Dalhousie School of Public Health, as well as our colleague Faraz Vahid Shahidi from the Institute for Work and Health. And together we proposed a project to Statistics Canada, which was recently accepted for remote data access. So it's a pleasure to be on this panel and talk to you today a little bit about that project and our policy partnerships. So our project is entitled Social Determinants and Social Impacts of COVID-19 in Canada. It has several components. Today I'll talk to you about one component that touches more closely on this panel's theme of education and social development. We're very excited to be working with our policy partner, which is the Division for Social Determinants of Health at the Public Health Agency of Canada. So we're thrilled to have them as a knowledge user. And a little bit of background about the project we proposed. So we're a team of social epidemiologists and public health researchers. And like other teams in Canada, we've been monitoring emerging evidence of social inequalities and COVID-19 outcomes, such as incidence and mortality. What that means is that there are certain populations that tend to be overrepresented among those who are becoming infected or dying of COVID-19. Depending on the jurisdiction, that can be, these groups can include racialized populations, low-skilled workers, and immigrant populations. And these inequalities, because they are largely preventable, present an issue for health equity in Canada. So this was relevant for our team and our research program, but also for the priorities and mandate of our policy partner at the Public Health Agency of Canada. And what we know from outbreaks of genetically similar coronaviruses, such as MERS and SARS, is that social determinants such as educational attainment has been associated with the capacity and likelihood of uptake of preventive behaviors, such as more frequent hand washing or the capacity to practice social distancing. And indeed, there are emerging reports relating to COVID-19 that the same types of patterning are appearing today. And that, so for example, individuals with lower educational attainment or working in lower skilled jobs tend to have higher risk of COVID-19 infection, in part because they're not able to work from home and because their work brings them in closer contact with others. So what we hope to do with one of the elements of our project was to explore these phenomena in Canada. And we'll be using data from the Canadian Perspective Survey series, which Mark mentioned, which asks a series of questions to a large sample of Canadians that are drawn from the Labour Force Survey sampling frame. Collection started in late March. And lots of topics are covered in the survey, including uptake of preventive behaviors, sources of information that are used to obtain information on COVID-19, financial stability, receipt of relief payments. So we'll be using individual level data from the CPSS and linking it to area level data from the Canadian census, the 2016 census, which will be linked to the CPSS using individual level postal codes. And that will allow us to look at some of the associations between individual and local area level social determinants of the uptake of preventive behaviors such as hand washing, social distancing, working from home. And we'll be interested in seeing whether there is social patterning across educational attainment, income, and various other factors. Wherever possible, given a data sample size, we hope to look at associations across strata of age and sex and province of residence. And we'll also explore how access to potential types or sources of educational materials on COVID-19 may moderate some of those disparities. So this is just one element of our broader project, but we think that the output will be useful for us and our policy partner in a couple of ways. So for us, it'll be useful to know, to give a better understanding of some of the behavioral mechanisms that could be driving social inequities in downstream outcomes such as COVID-19 incidents. And for our policy partners, what they've expressed to us is that the output from this type of question will help in their COVID-19 programming planning to make sure that their programming is aware of different social and economic contexts and is adapted to different capacities across populations to take up behaviors based on resources and social contexts that they may be facing. And then on the longer term, the project will help inform their pandemic preparedness planning efforts in the future in a way that can integrate a health equity lens and integrate a better understanding of how social context can influence distributions of risk. So we're very excited and very grateful for Statistics Canada for the opportunity to pursue these questions, and I'll leave it at that. I look forward to answering questions.
Thank you very much. Okay, so Q&A. We got 30 minutes, and we'll start with Catherine and Mark. There's some questions for everyone that we've received ahead of this particular webinar. So we're now just providing these, and as we go, we will go through the Q&A box, and our colleague Byron will help us with that. So the first one, we'll start with Catherine, and then Mark can follow up, is how are researchers and policy bodies and StatsCan assessing the impact of the pandemic on the quality of teaching and of learning?
Okay, so, well, if we come to quality of teaching and learning, the tools that are currently available at Statistics Canada do not really allow us to assess what's going on right now. So obviously there are some surveys that could be used to look at what have been done in the past. And I think there are some crowdsourced survey on the I don't know how to say this, sur le terrain in French, that are running right now that maybe in which we may be able to add questions to get a better sense of it. And I do think Statistics Canada has more agility than anyone else in the country to answer such questions. And I do hope that we'll be able to add questions either to some of the crowdsourced survey to be able to better understand what's going on in terms of teaching quality and or teaching at all at the moment, especially in Quebec. And also maybe there are other surveys that go on the field every month. For example, the labor force survey, in which we could add 1 or 2 questions to understand better what's going on. So I think some actions need to be taken for researchers to be able to understand what's happening right now. So maybe Mark would have more answers on this.
Yes, excellent question. I mean, I'm seeing it right here as a parent with 2 kids in secondary school, and then my wife's a teacher. So I'm seeing a wide degree of variability of participation of students, and that's a very important factor in the educational process. So obviously, it'd be very nice to have data at the national level so we can get a good picture of this. Catherine mentioned that there was some data that are coming out that will address this. We do have another crowdsourced survey similar to the one on post-secondary, but for the younger kids that doesn't have a fixed release date yet. But I believe perhaps late summer is a possibility. But I want to pass it off to Pamela Best because that's really in her area. So if we can get Pamela Best to add to that, if we can get her on the line, and she is on this meeting. Yeah.
So I have unmuted. I don't know if you can see me or hear me. If you can hear me, nod. Oh, good. Thank you. Okay. So there's the crowdsourcing is going out in early June until June the 22nd. And it's a focus on children with families where they're looking at various aspects of the impact of COVID-19. The question is being asked of parents. And from an educational perspective, we're looking at the number of times in a given week that children are involved in sort of these unstructured activities, such as reading books or stories, how much time they're spending on their screens, And if my line cuts out, it's because I probably have a couple of kids gaming at present. What they're doing in terms of music, drama, physical activities, structured sort of academic activities, and then more specifically academically, how many times is someone in the family helping children with their activities related to schooling? We're also asking in general concerns, though, about, what are worrying parents as well. So are they concerned about the physical health of their kids, the mental health of their kids, loneliness, isolation, online safety, etc. And then family behaviors as well. So staying connected, supporting each other, tension in the household, having less patience. So I think things that we all experience as well, or at least I do.
I have perfect children. I don't know what you're talking about. Merci beaucoup. Anything else to add, Catherine or Mark?
No, I think I'm good. I would just like to, maybe, I don't know, it's going live in June, so maybe it's too late, but I do think we need to ask what kind of support parents are receiving from the schools across the country. We need to know what's going on. Education is economists often say the returns to education is the best return you can ever get. So we need to know what's going on for this new generation growing at the moment. And I think we have work in our group on intergenerational transmission of income, and we're looking at the impact of education on that, and it's non-negligible. So education touches many phases of life, including health also. So I think we do need to have better question on what's going on at the school level also.
And if I could,
yeah, go ahead, Mark.
Oh, if I could just add, I think there might not be a whole lot more that we can do right now to answer the question right now. Although if people on the line have ideas, we're certainly willing to listen to those. But let's not also forget that in the long run, once all this is said and done, there could still be valuable lessons learned from this experiment. And you can think of it as a natural experiment, right? There's this big shift towards online learning. What did that mean for educational outcomes? And we'll be able to capture those things in the years to come. So it doesn't help us now, but years from now, it might actually help us. So let's not lose track of that. But obviously for now, let's try to focus on answering the questions that are relevant for the moment. And we're trying to do that.
Well, Catherine, the good thing, and I'm sure everybody else knows, but I get to work also with Mark's colleagues. So everything you guys tell me, I normally take notes like the same way as I did when I traveled the country to meet the RDC folks. So I'll make sure I pass it to Lynn as well. It was our Assistant Chief Statistician of Social Studies.
Thank you.
Okay, I guess we'll go to the second question. So I guess this time, Mark, you're again on deck. I don't know why I'm oversubscribing you here. So here we go. We'll start with Alexandra though first. Which of the survey by Statistics Canada will be able to directly capture the impact of COVID-19 or the pandemic?
Yeah, so this is a great question. For another element of our project that I didn't present to you today, but we're looking at the impact of various confinement measures on inequities in earnings and wages across various groups and sectors of occupation. And for us, access to the labor force survey will be useful to look at those impacts for a couple of reasons. One, well, two reasons specifically. One is that it offers data on the outcomes of interest both before and after either this intervention or this exogenous shock that is the COVID-19 pandemic. So that pre-post information, and also it gives us enough information on individual level characteristics that would allow us to assess and try to minimize potential sources of confounding bias in our analyses using various statistical techniques. So those two data requirements are essential for when we're trying to look at the impacts of COVID-19. So the LFS meets those standards for us, but I think for for those who are interested in exploring other data sets, starting at the StatsCan website is a good first place to see what's available, what public use microdata files are available, and going from there.
Okay. How about we go to Mark now that you have your opportunity to do that, or your colleagues?
Yeah, I'll say a couple of words and then I'll pass it off to Steve, who I believe is on the line. So just a moment ago, I talked about how we shouldn't lose sight of the fact that we could learn something from this years from now. Well, going backwards, we can actually use older data pre-COVID, not too old, but pre-COVID, and learn things about the COVID situation. And a perfect example was the study I talked about looking at online preparedness of school children. That was pre-COVID information. So that kind of points out the vulnerabilities heading into COVID. So that's certainly one option. But really, you know, we also want to fill those data gaps and ask questions related to COVID as they unfold. So for that, we're talking about things like, well, there's timely data on the LFS side, like Alexandra said. LFS is definitely very timely and has some interesting data in there. But there's new data requirements for COVID. And for that, we're talking about the new social surveys, the Canadian Perspective Survey Series, as well as the crowdsourcing data, which I'll let Steve say a few words about right now.
Great, thanks so much. Yeah, can everybody hear me okay?
Yep.
Wonderful, great. Yeah, so yeah, Mark's exactly right. So, you know, one thing that we've done here at StatsCan is to, you know, in light of the data needs that COVID have brought up, we have done what we can to move quickly to get timely data. So, you know, early on here, we recognized that it's one thing to have economic indicators. Those we can have in real time, and they're available, and we can track them as things change. What we don't necessarily have access to are real-time social data. And so we were fortunate that our colleagues had put together the blueprint and the spine, if you will, for the a web panel. So by using rotate outs from the LFS, a group of 7,200 or so Canadians had agreed to participate in ongoing web panel surveys. This was set up just in February, and so we were ready to go when the opportunity presented itself to get data relevant to COVID-19. And so in order to fill gaps that we had internally, but also that FAC and Health Canada and Finance, the SDC, and others had, we jumped on the opportunity to go out and ask a handful of questions, about a series of about 15 or 20 questions in the web panel, to get information about the social impacts and the economic impacts of COVID-19. Now, the nice thing about this, because it is a web panel based on the LFS, it is a probabilistic sample, so we are able to generalize to the Canadian population. The other technique we've used for getting real-time data is a non-probabilistic approach. That isn't something that StatCan has traditionally done, but we have invited Canadians to participate in a crowdsourcing exercise whereby anyone and everyone is invited to participate, complete a very small number of questions, about 10 or so. And again, we're looking for impacts of COVID on the social lives of Canadians. And so this here, you know, we have done a series of these now, about every 2 weeks or so. One that was general in nature, looking at overall impacts of COVID-19. The second one, which is very relevant to this group, where about 100,000 post-secondary students responded and have provided the impacts, you know, answers to questions about the impacts of COVID-19 on their situation, and on from there. So we've also looked at mental health and other issues as well. So that's a bit of a summary in terms of what we've been doing relative to timely social data during COVID-19.
Thank you, Steve. I guess the last set of questions before we go to Byron. So we'll start with Cindy, and then on retourne à Catherine. So how do you think we can better, I'll start again, how do you think we can do better with education and scientific communications in the Canadian the Canadian space moving forward?
Sure. So I think this is a great question. And I think that, like everybody, the public is reading and trying to learn about this pandemic in real time. You know, we have their attention, and now it's really just about what do we do with that? So we have a situation where decision makers are asking people to do really hard things, to not visit their elderly family members, to work from home while parenting and educating their kids, or potentially to have lost their job and their income source. And if people can't understand the evidence base that's driving that order or recommendation, that's where I think we're seeing this breakdown of people not kind of getting on board with that. And so I think that one of the greatest things that researchers can do, of course, first do rigorous modeling or analysis, but then it's really about how do you explain this in plain language? So can you find a visual that tells the story? Can you create a one-page document that explains to a non-technical audience what you've found or shown or modeled? And can you just figure out a way to make it really simple? And also being prepared to talk to media to explain it, because really the people that are getting media time, the researchers that are getting media time, are the people who have practiced quite a bit and are able to have these sort of plain language conversations. So, the more technical that the work is, I think the more that the need is to diffuse that work down to something that the general public can understand, and to really increase the impact. I frequently am reading, I'm an economist by background, and I am frequently reading highly technical papers and wishing that somebody had the time to distill this down to something that could really be used by the general public. And I think that it would have a major impact on how people, how much people could get on board with some of the hard things that we're being asked to do right now.
I love the idea of storytelling, because that's how I started my career, my professional career. So, and I was just reading something that I'll share through Chloe to the rest of the community from Great Britain, where they talk about scientific communication, but in the health side. So there's some of these same lessons about storytelling. Catherine, how about you? What do you think?
Well, I'm going to follow up on that. I think what's coming out of this, and I think it's great, is that I've seen that we work more together, researchers, the community, Statistics Canada. I've seen large effort, especially from Statistics Canada, to try to come together and try to answer questions that are relevant for the government, either federal or provincial or even local. And this, I think, is something that we should keep on going forward. And I think for young researchers listening right now, I think these relationships take time to build, and they need to build them right now as they go. And so the partnership we have developed and that allows us to access the data right now has not formed in the last 3 weeks. It was something that has been built over several years. So I really think we need to work more together to answer questions that are relevant for our communities. And I think the idea of coming up with short papers, 2 pages that summarizes our main finding is extremely important. And here in Quebec, we have an organization that overlooks all of the economists. So it's called Cyrano. And what they're trying to put together is a series of memos that go straight to the government and that summarizes all the work that we're doing. So I'm actually this morning writing a memo on the paper I was referring to on inequality across the country in education. And I think this really helps people actually reading what researchers are doing and using it, because people don't have time to read like 100 pages long papers. So that doesn't make sense, but these papers are essential to provide the quality. So, and again, I think researchers are extremely important in this, in all of the efforts we're doing, because it's not because we want to go fast that we should do work that's of lesser quality. So we need the quality, the long paper that justify our choices, and then we need the memo that show, okay, this is the message you need to remember and communicate to the people that are making decisions. So, and I think the pandemic, although it's catastrophic for so many people, I think it's bringing us closer together in a way that wouldn't have happened before if this hadn't happened. So.
Merci, Chloe. Just before we go to Byron, I'll get him ready to see if we can ask questions from the participants. But Some of you might know my email address, and if you don't, jacques.fauteux@canada.ca. And if you have ideas of how we can communicate better, not only through the RDCs, which we started to we reopened one earlier this week at Université Laval, and through initiatives that we're doing with Alexandra and Catherine. But if you have other ideas of how we can communicate better, I also lead that part of the StatsCan family, which is the whole 100 and so many people that are responsible to get data connected with people. So you can send me an email. So Byron, do you have anything for us for questions?
Yes, a number of things have come in, and thank you very much. I'm surprised and very pleased, I must say, to realize the extent to which StatCan has managed to be nimble in this situation. That's not a word I thought I'd ever use with StatCan, but there we go. I think it's quite remarkable. Let me say that a number of the questions that have come in relate to crowdsourcing in one way or another. One question concerns the representativeness of crowdsourcing and what StatCan thinks it can do with the data that would get from crowdsourcing. Now that's partly a question to StatCan, but I'd certainly like other people to come in as well with views as to what could be done with data that come from crowdsourcing. Maybe we could start with Mark.
Marc, ou toi ou tes collègues?
Oui, okay. Yes, that's an excellent question. Crowdsourcing, I mean, the first thing that comes to mind as an analyst or researcher is, what about the statistical representativeness? And we did some work on a crowdsourcing app that was way before COVID, a year or two before. Some of my colleagues, Grant Schellenberg and Ruba Barim, they did some work on something called the Carrot app, and they compared some variables, about 10 or 15 variables collected from those data to the GSS, the General Social Survey, and they did find that there were some differences. So it's not totally representative of the entire population. So where I see the crowdsourcing apps as being beneficial is that we do get larger sample sizes, and larger samples are not just good for the fact that they're larger samples, but they do allow you to distill down into smaller cells. And when you do that, if you start breaking down the analysis by more and more detail, then you're reducing the possibility for biases in representativeness to arise. So if you break down your analysis, say if you had a huge crowdsourcing app, just say for argument's sake, say you had 10 million responses, and then you can break it down by all sorts of variables, hundreds and hundreds of variables, then eventually you're going to get something that's representative from that very tiny cell, right? Now, for that group, you can't necessarily bring it up to the national level, everybody combined. So there are still some benefits to looking at detailed analysis, and that's where I would encourage the analysis to go with crowdsourcing app. Break it down by detailed cells as much as possible. Take advantage of those cell sizes. On the post-secondary education crowdsource app, there was over 100,000 responses in a very short period of time. So that's what I wanted to say on that. I don't know if Pamela wanted to add anything to that. Oh, one other thing I'm going to add is that, and I'm not from the methodology side, but I think potentially we could think about creating some sort of importance weights. That's what I call them. They're not sampling weights in this case. They would be importance weights that would somehow make the data somewhat more representative of some population that we're interested in. So theoretically that's possible, but I haven't had that conversation with methodology at this point. Pamela, did you want to jump in?
Well, I just want to say that for the post-secondary crowdsourcing, one of the things we did is we benchmarked the weights as well, or we benchmarked the counts to the data that we get from the post-secondary student information system, or PSIS. So I think, Mark, that's kind of touching on where you were going with the importance. So it's not, we're not weighting the data, but we are benchmarking it. And as we were doing collection as well, we recognized that there were some provinces where the reporting wasn't what we expected. In terms of the proportion of the respondents who could have come from that province. So we then increased our efforts in outreach in order to be able to bump that up. So we're trying to get a little bit more representativity in that way as well. So, Byron, I know it's kind of uncomfortable to say Stats Canada and Agile, but I think we really did sort of test ourselves in many areas in this regard, not only in terms of developing questionnaires rapidly, getting them to the field rapidly, but as well as innovating in the way that we were doing our communications around this. One of the fun things about the post-secondary crowdsourcing as well is that we happened to be in the field at the same time as the announcement about the Canada Emergency Student Benefit. So we could see of the people who participated in the survey what their concerns were financially, both before and after the announcement. So that's a bit of a rarity from a Stats Canada perspective as well.
Yes, very good. Maybe we could go to Catherine to ask how useful she thinks such surveys might be. I shouldn't call them surveys, but crowdsourcing might be in the context of education research.
In my view, they're the only surveys right now that we can deploy fast and that can give us answers on what are people experiencing in their homes. So in my view, it's the best we can get. And in some ways, I was thinking just before Mark mentioned it, yes, we can benchmark to other sources of data that we have. And we know, for example, if we have some key questions in those crowdsourcing surveys, we can look at the representativeness. So if we just think about parental education, it plays a really strong role in education of the children in general. So if we ask the parents to report their education, we know what the distribution of education looks like for children if we use census data, for example. So we are able to see who we're getting and who we're not getting. So I do think they would be extremely valuable. And I'm actually really happy StatsCan's going down that road. And eventually, I don't know how the choice is made, but it's probably easier if the sampling, if you use a survey that exists and then send this to the links you already have, but maybe that's too hard for them to do. I don't know, but whatever the best way they find, I think we should be happy they're making these efforts.
Okay, well, thank you very much. I think, Jacques, do we have time for one more question?
This is where I'm giving you the thumbs up. I'd probably say rapid fire, if you have one, so that we can go to Alexandra and Cindy.
Yes, okay, well, this would be a natural for them. Does anyone, the question came in, does anyone look also at personality/skill sets of a child in terms of education? This will be a negative shock for athletic or extroverted students, might be a positive shock for other more introverted students.
How about we start with Alexandra and then we finish with Cindy?
Yeah, well, Cindy might be the best person to answer this question. Maybe I'll let her start and then I'll jump in. Maybe
that's funny that you say that. I was going to defer. I'm actually not from the education space, so I don't know if the others want to.
Maybe one thing I would say, just based on the last question that was asked, just just to add a little note, is that in terms of being able to benchmark across various social markers, it's that much more important for us to include questions in our crowdsourcing questionnaires about indicators that we might not always ask because we have limited space or time, such as information about respondents' race or income level or some sort of a socioeconomic marker, as well as immigration status. That kind of information is also, we don't always put them in, but they're super useful, especially if we want to draw inferences for populations we know might be more vulnerable in this context. But with regards to children's I'll pass it to maybe Catherine or.
Yeah.
Catherine, you have 30 seconds.
Yes, I can answer. I don't think we can infer that children who are more introvert will be less impacted than children who are more extrovert. Is that what that was the question, right?
Yes.
No, I don't think we can conclude that. I think children who are extrovert actually are finding all sorts of ways to connect with their friends. My son being one of them, and he's the pandemic is not being hardly felt by him. I think they find ways. Children are imaginative, so they find ways to connect with their kids, their friends. I actually think that children who are introvert do need the social contact to develop that skills. And I think it's actually them that will be impacted the hardest in this pandemic, because right now it's just easy to sit back, not avoid social interaction, stay at home, read your book, and don't have to develop that skill that will be super useful for the future. So I wouldn't actually would be tempted to think that the opposite will happen.
Thank you.
Okay, I'm closing it. I'm pushing everybody out of the virtual space. I'm thanking CRDCN for their innovation, because this didn't exist before the pandemic. I'm thanking you to enabling us to push that scan to be even better for you. I invite you to participate at the next webinar and be part of the experience. It's on May 27th. It's on immigration and settlement. And last but not least, I'd like to thank not only Chloe, but the participants, or the panelists, I should say, for their involvement. And if you have any questions, crdcn.org for any of those particular questions related to the network, statscan.ca for any of your work with the statistics. And until next time, merci beaucoup.
Merci, thank you.